that there's a challenge when it comes to the training part of it. When the medical students are being trained, there's a challenge when it comes to interpreters and so on. But now, when you guys run your clinics at LVCT and as well as your other colleagues across the country, when deaf patients walk into the clinics, do they receive equal care? Or are they still sidelined? I mean, we've just heard from Vincent here that, even at the moment of procuring education, there's still, a bit of sidelining that's happening. Is that the same when it comes to healthcare?
Thank you very much, and thank you for giving me this time. What you have really much said is about access to the medical health in LVCT. Now, when it comes to the deaf people, now there's an experience that I encountered. What happened is, and also what I also do think, what my brother said is policy. Policy is a challenge. Now, when it comes to medical, whenever any deaf person wants to accesses that place, now there is a problem, but how do we get to solve it? But if we have stronger policies that might apply in college, such as training also sign language in the colleges, that can be a better method to solve that. And that being a beginning, like in many instances we have seen in Kenya, like people go to learn or take their studies in colleges. If we have inclusion, when you check on matters inclusion, it's not there in the colleges that we have right now. After the student finish their learning career, their learning moment, they don't get the knowledge of sign language. But if sign language is also included in these colleges, when we say about interpreters, this can also be a solution. And how can this be a solution? We even ask the deaf community, we also believe in ourselves. Okay? As said, outside there, we have many people who, give attitude to the deaf people. For example, if I give an example, even in the villages, in the rural areas, we receive attitude issues. Now, even when I go outside and I've received this, I also see the same happening. You see? So, what do I mean? What even is better is dependence on interpreter is not even the perfect solution. But even getting a deaf person or employing a deaf person in the hospitals itself, right? That will support when it comes to the help. Now, as people say, interpreters. No. That is also another way of sidelining deaf people and, turning them to something equated to beggars. But now, what do I think? We should also reduce at least the dependence of an interpreter by getting even a deaf person in the hospital. And when we employ a deaf person in the hospital, they can also provide the training inside the hospitals. That is the staffs, that is the volunteers, the matrons, the nurses. The deaf person will provide the assistance, not depending just on an interpreter alone. Because we also believe in ourselves. A deaf to deaf person, it's also easier. Communication becomes easier. Communication access becomes easier. But even when we check even in the organization, I'm deaf. But we have different partners. For example, we have in federations, right? We have different federations that provide these services of training, such as Kenya National Association of the Deaf. But now in the health sector, it's always direct. And it is always, to me, at young, direct. And that way, communication is easier. And even it's easier to meet even deaf people. And reaching this, it also makes sure that we have something what we call inclusivity. Inclusivity is the deaf people also being in these medical sectors. And when I try to rate, I can see it's poor at the moment. But now, when we go to the colleges, we have nurses being trained. We have services also being trained in the colleges. But now the question is, if we can be able to train the deaf, why an interpreter now? What we have seen, people, giving the perspective, it seems like deaf people are like fools, in quotes. But now, the deaf people are not fools. They are able to understand. If they're provided training very well, they can become very better. Now, on dependence of an interpreter alone, that is not a full assistance. But also, if we get a deaf person added to these medical sectors, it will be easier, even access for all other deaf.
All right.
And when you say interpreter, you know, it comes also with the ethic. We need confidentiality. And this is a medical sector that needs confidentiality. So when we say deaf an interpreter, that brings a third party and now brings poor services also. Thank you.
Yeah, thank you for highlighting.